that have got arthritic dogs are going, why are they choosing such a specific disease to talk about? It's because it is such a big source of arthritis. We need to understand it. And there seems to be a little bit of disconnect between, oh, it's got cruciate disease, and people taking the next step and going, well, actually, that leads to arthritis. And that's why Karen's here. And she's going to be answering all of your questions.
Trying.
Please tell us a little bit about yourself so people can have trust and faith that you know what you're talking about.
Yeah, absolutely. So, hey everyone. So I'm Karen. I am one of the orthopaedic faculty at Michigan State University right now. As you can tell, I'm not originally from the States, at least hopefully you can tell. Hopefully I haven't lost my accent yet. Originally from the UK, and I did my residency at University of Edinburgh, and then worked at the Royal Veterinary College for 4 years thereafter, before transitioning across the Atlantic to come and work with some fantastic mentors and people over here. So that's a potted history of where I come from and why I'm here today. And
you've actually got some added qualifications. You're a little bit of a teacher. You're a little bit of a teacher as well, with added qualifications, aren't you?
Yes, I just finished last year. Finished a master's in veterinary education. So that was again done distance-wise through the RVC. So that's my most recent thing. I have one of those OCD things about collecting qualifications. So every time I do one, I decide to do one. I decide it's a really great idea. It won't be that much work, and I'll be able to do it in my spare time. And then I curse myself throughout, and then I give myself about 3 months off and decide to pick up something else. So
you're nuts.
Period.
You're nuts. It's crazy. Seriously, she's collecting the alphabet, basically, the only way I can describe it. So let's crack on, because we're going to do 45 minutes today, because we've got clap for carers at 8 o'clock. So I'm going to be very conscious for the time, and we're going to try and move quite quickly. People that have specifically tuned in to watch this, please get your questions in, and we'll skip through and get to questions, get into the nitty gritty for people that have got specific questions. But let's start. Hey, Bill. Hey, Lynn. Hey, Jody. Let's start with, how common is this? And then let's progress from there.
Right. Well, I mean, cruciate disease, I think we'll talk just in terms of, instead of just specific numbers, I think just in terms of what we see. Now, cruciate disease by far is the most common orthopaedic condition that we treat as orthopaedic specialists. So in general practice, obviously that is arthritis, and it's arthritis of everything, and that kind of gets lumped in together. But as soon as you get into specialist practice, we know that cruciate disease is the most common condition that we see, to the point that we will quite frequently be seeing 6 or 7 dogs a day with this condition and operating a good percentage of them the following day. So about 300 a year is the surgical procedures that we do for this. And that's just our facility. So.
Wow. And that's a definite cohort of people coming to you, and that doesn't take into account all of the other. You're a very specific facility.
Absolutely. Absolutely. So that's a tiny percentage of the dogs that have it, because as we'll go on to discuss, I'm sure, like financial restrictions, just personal choice, not everyone comes for surgery. So.
Okay. So let's lead quickly on, what kind of breeds are we talking about? What is the spread?
I mean, really, it can affect any breed. I mean, the ones that we will see most commonly presenting to veterinarians with this condition probably are the larger breeds, because they're the ones that tend to need attention the most, if you like. They don't do so well with whatever we term like benign neglect. It doesn't tend to just get better in the larger breed dogs. So the larger breed dogs will be the ones that we see most frequently, but it can affect any breed. Labradors certainly being probably the number one that everyone will think of in the top of their mind with cruciate disease. But disappointingly, we are seeing in the giant breeds this condition affecting them really, really young, and bilaterally really young as well. And I think that's a trend that a lot of people are seeing, the Newfoundlands and the Mastiffs that are coming in before they've even finished growing with this condition on both sides. So no breed is spared from it, but pedigrees certainly seem to be a higher risk, and Labradors, the giant breeds, being the ones that we see the biggest problem, I guess.
Yeah, and this is where I would love to have a little pop-up that goes breaking news, so that people can actually hear keywords. Cruciate disease, young dog, OA. So cruciate disease, young dog, arthritis. We need to drift away from a belief that this disease, arthritis, is always just getting old. Well, it comes part and parcel. It really does not. This is why CAM is here, is to try and get people to rethink this disease and realize that it's something that can affect a dog from a very young age for the rest of their lives. Okay, so we started talking about a breed, so therefore we're now starting to think, is there a genetic basis to this?
Yeah, absolutely. And I saw that question pop up from John there about his boxer dog. So certainly this is hereditary for sure. It does have a genetic influence. However, it's not quite as straightforward as just saying it's genetic. I mean, there definitely is a genetic influence. And if your dog is genetically predisposed to develop cruciate disease, it probably doesn't matter what you do. You could wrap that dog up in cotton wool and not let it exercise ever, and it would still happen, just maybe a few months later. So definitely it is genetic, but there is also that multimodal input to it that with how we're exercising them and certainly being overweight, all those things will potentially make it happen sooner. But genetics is going to be that major underlying factor for sure.
Yeah, and what I was reading from your 3 amazing articles, which Vet Times, I shouldn't say this, you can read, guys. It's in a UK publication called Vet Times. Karen does a 3-part series about cranial cruciate disease. Yes, it says, are you a vet? I know that you could say that you're a vet on a temporary basis. It's so worth the read and fantastic collection of articles. Right. So what other things do we know influence cruciate disease? So we've got our genetics.
Yeah, so genetics being the big one. Now, certainly it does seem that and I can't really explain why, whether it is just a stronger genetic influence, whether it's increased weight, whether it's anything to do with that, but the giant breeds do seem to be developing this younger. So when we look at most of the literature, it will tell us that the peak age of onset for cruciate disease is going to be around 4 years of age. That certainly appears to be getting younger in these giant breeds. So that's one input. Breed definitely has an impact there. Exercise, not really a proven impact in terms of whether you're going to have a dog that's more likely to develop it sooner rather than later. But weight definitely, as with all the arthritic conditions and most joint conditions, really, weight is going to have a huge impact. So if a dog is overweight, then they're far more likely to develop this condition earlier. We do know that dogs that are obese are just inherently more inflammatory. Their entire body system is more inflammatory and they react to all of those things worse. So definitely keeping dogs' weight under control will help. But I think if we're educating people that anything that they can do with their dog is going to prevent this happening, there isn't really anything. If the dog's predisposed genetically, it's likely it's going to happen at some point. So it's no one's fault. It's just unfortunate genetics.
We have a little few connections, but it'll be fine.
Oh, I'm losing you.
Double check, look back yourselves, do your body condition scoring, see if you can feel their ribs. There's a real tendency for people to just go and sit back on their laurels and go, no, my dog's weight is fine. I can promise you 4 out of 5 dogs that I see when I walk my dog are fat. And those people are walking along really quite happy that their dog is fine. So critique yourselves, please, critique yourselves. And it works every time. I want you to take your eyeballs out, put them back in, look at your dog and pretend it's not yours. And be cruel to be kind. Is your dog carrying too much weight? Okay, so there's also that genetic conformation. So a lot of people talk about the straight leg breeds. Explain that to us.
Yeah, so there's a lot of chat about how dogs that have a more upright pelvic limb stance might be more inclined to develop cruciate disease. Now, when we actually try and look at that in terms of looking at papers, looking at angles specifically, it just certainly doesn't appear to be quite that straightforward. In terms of the slope on the back of the tibia, on the shin bone there, some people, well, I guess it would make sense that if that slope is higher, the dog would be at increased risk for cruciate disease. But very few papers have actually managed to confirm that. But certainly having an upright pelvic limb stance is one of those things that's postulated and put out there as potentially being causative. It's not something we've ever managed to prove per se, and it's probably all just wrapped up in the genetics rather than being a simple, if it's got an upright pelvic limb stance, then it's going to develop cruciate disease.
Okay, cool. Okay, so let's just see. I'm trying to keep up with the questions because it's going to be thick and fast. Is there a difference between lifestyle and cruciate disease? Well, I think we kind of answered that. I think I would be outlandish, and I know Karen won't say this because she's much more sensible than I am. Stop throwing balls! I just think it's just so simple. There's so many other wonderful things that you can do with your dog. Yes, I do totally agree that there's going to be a predisposition, but let's take away the acute traumatic nature of them just going if we can. My Vizsla has had both cruciates operated on at 3 years, had a lot of behavioural issues, 6 previous homes due to pain, which was undiagnosed. Awesome. That leads us straight into what are the clinical signs? Is it always an acute sudden onset? Is it a dragged out history? What do you see?
Yeah, I mean, I would say most of the time with this condition, it does appear to be acute. When you kind of listen to the history for these patients, it tends to be that owners perceive the dog to be completely normal. They went out and did something that they would normally be able to do every day, maybe just went out for a walk, maybe jumped off the deck, maybe just went down a few steps. And then they noticed that a very acute and severe lameness came on from that. And so it's often assumed that there is a traumatic cause. Owners often come to me saying, oh, I must have missed something because it was so acute, it was so sudden, he must have stepped wrong, he must have done something. And you know, it's not that anyone's been missing anything. This condition generally does present like that with an acute onset lameness, even though it is a chronic condition. It has been coming on over time. So if we think about the ligament, I always kind of say if the ligament's like a piece of rope, just imagine it's been fraying and fraying and fraying over time, but it's still been, there's been enough of it that it's still been able to do its job, and you haven't had that associated instability of the knee yet. And then it's only when those final few strands go, or they get a meniscal involvement as well, or enough of the ligament goes that we have some instability, that the dog suddenly represents itself as being super painful. So it is chronic, but it presents as being acute.
Yeah, and I think also to add to that, dogs are brilliant at weight shifting, and it's so hard to see. You know, you really do have to have quite a percentage, you know, decrease in weight bearing for you to actually visually see lameness. And if it's back end, they're really good at throwing their weight forward, and you would never know. So don't beat yourselves up, guys. You know. Okay, so how do we actually bounce back is question 5. How do we die? You still hear me?
Yeah, I didn't hear you there.
Okay, how do we diagnose it?
Okay, so yeah, so diagnosis is multifaceted, really. So when they come in with a history and a typical breed, a lot of the alarm bells are already going off, right? You're thinking, I think I know what this might be. Then the next stage is going to be just doing a general examination. So just by laying hands on the dog, obviously, when you first watch the dog walk around, you're going to see that they are, as Hannah mentioned, shifting weight. If we see these dogs very quickly, immediately after they've ruptured the ligament, it tends to be a very severe lameness. So they're often either non-weight bearing or just toe touching the limb to the floor, and shifting weight the vast majority of the time, often a little uncomfortable getting up and down because they don't want to flex and extend the knee to get into that normal position. Very commonly, we'll hear owners say that the dogs have started to sit differently. So instead of sitting with their legs like crunched up nice and neatly underneath them, they'll sit with the affected leg kicked out to the side. And that often gets termed as a positive sit test. And it's something they do to just prevent themselves having to flex that knee quite so much because that's uncomfortable for them. So definitely lameness, definitely altered sitting position. And then when we're having a feel of them, one thing that we can feel very easily without putting the dog through really any discomfort at all is when they're standing. We can feel they should have a nice sharply defined ligament that runs down over the front of their knee. And we should be able to feel almost like a defect on each side of that. And as soon as their cruciate ligament ruptures, or as soon as they have this disease, they develop a fluid swelling in the knee, which means that you can no longer really feel that nice straight ligament down the front, and you have like a pouching out of the fluid on each side. So those are the kind of very like non-painful ways to assess that this might be the problem the dog has. And then see pain on flexion extension of the knee is pretty common. Sometimes if a meniscus is involved, we get some clicking associated with that as well. Owners will often actually tell us, I can hear the dog clicking when it walks, which is obviously very unpleasant for owners to experience. And then there's also just the very characteristic test of checking for the instability of the knee. So checking for instability in either cranial draw or cranial tibial thrust, which is 2 ways of doing the same test, just really checking, can I move the tibia or the shin bone relative to the femur or thigh bone? And if you can move that, then, you know, that's really pathognomonic. Your cruciate ligament is ruptured.
Yeah. Can you do it with your hands? It's a bit difficult.
Yeah.
When people, yeah, you show. so people know what you're talking about. It's
right. So if you've got your tibia here, if this is my tibia, and it's got a kind of slope on the back of it, like kind of like that, and then your femur is obviously a rounded structure which sits on the top. And if I try and move these two bones relative to each other, I shouldn't be able to, because the ligament should sit in the middle like this and prevent that motion. But if they have a cruciate disease, I can bring the tibia forward relative to the femur, and that's the kind of what we're all trying to do when we're just manipulating the dog's leg like that.
Yeah, and so sometimes it isn't so easy though if they're painful, because all the muscle guarding will actually make it look like the ligament's still intact, and that's why lots of vets then say, I believe it's this is now where I need to sedate and actually take, voluntary muscle guarding, involuntary muscle guarding away, so that I can see what the movement is. So we do need to sedate often for this, and definitely for the next part, which is imaging.
Yeah, so and I think the other thing just to bring up there is that the cruciate ligament, dogs can be very severely lame associated with cruciate ligament disease and still only have a partial tear. So if the part of the ligament is intact, sometimes that instability test is still negative, even though they have that disease. That's why it's important to check for the fluid swelling and all the other signs that we talked about as well. So just getting to one of the questions Lynn had asked there, is it true that if one cruciate ligament tears, the other one is likely to? Very, very common question from owners, and unfortunately it's all bad news from here, because essentially if one cruciate ligament has ruptured, and if it is a degenerative rupture as opposed to a traumatic one, then the risk is 70 to 80% of dogs over 2 years will rupture the other one. So it is more likely than not that the dog will end up with a bilateral injury.
And that's where I can step in and be a little bit nosy. I was listening to someone talking about, is it just the mechanical overload of the other limb that they're degenerating, or is there some kind of systemic inflammatory thing? Do we know why?
No, I think it's just the nature that it is a genetic degenerative condition. So if they have it on one side, they likely have it on both. I think that's reflected by, unfortunately, obviously insurance companies. If your dog's had one cruciate ligament rupture, they will rapidly write off the other one if you change insurance companies. So watch yourself with that. And if you've had one cruciate, don't change your insurance. Make sure you make
breaking news. That's another take-home message. Don't change insurance company, guys, because that is actually one of those things that breaks my heart when they come in and go, yeah, well, we've decided to change insurance company because we know that we need to be with a good one now. And I'm like, don't change insurance company.
It's heartbraking, but you need to stick with that company if you've had one cruciate with them. So
stay with. We'll come back to physio in a little bit. I haven't forgotten you, Bill. Is this something physio vet can? Is this something a physio or a vet can pick up pre-rupture, and then can prehab prevent rupture? That fits in with physio, but can we pick it up before they fully go?
So you can have a very good idea. This is what's going on before it fully happens with a full exam. So that fluid swelling in the knee will pre-exist a complete rupture of the ligament, because the inflammatory changes are already occurring within the joint. So you can often feel that earlier. There's another sign which you can pick up earlier as well, which is called medial buttress formation, which is basically a formation of fibrous tissue, which occurs secondary to the associated inflammation and maybe instability on the inside of the dog's leg. So just at the level of the knee joint, if you just kind of run your hand over the inside of the leg there, you can often feel that it's more swollen than the other side, and that's can be used to preempt that this dog is going to develop cruciate ligament laxity in the future. They already have disease, so I don't think you can kind of pick up that they're going to develop disease, but once the disease has started, you can pick that up before the full rupture occurs. The relevance of that, however, is a little bit difficult, because there's not really anything we can do to prevent that going on to become a full rupture. So it's really just warning people that this is, pretty imminent, most likely. But really, again, even if at that point you just stopped exercising your dog completely, you did all the rehab in the world, I don't think there's any evidence that you could prevent that ligament from going on to rupture. It likely will in the future.
It likely will. Okay. I had a really good one, but it's gone. Oh, yes. No, I was going to tell everybody that I have managed to persuade Karen. She's going to hopefully release some videos that owners can use to help you learn to examine your dog better, which is amazing. So we all need to say a massive thank you, because that's huge. We're going to try and give you guys more content so you can palpate your dog and you can have a better understanding. Why is this important? Well, we've got the COVID crisis and a lot of people can't get to the vets, and moderate lameness isn't considered emergency currently. But for me, triaging you on the phone, it'd be nice to have owners that could be able to locate where the lameness is and be able to give me more info. And the other reason is some dogs actually are very scared of coming to the vets. So owners coming to me with a bit more information is always well received. So well done, Karen. So medial buttress, explain to people why that tends to form so they can just understand the biomechanics again, because we have to keep going back to that so we then understand what we try and do about it.
So the medial buttress is it's difficult because I think when everyone first started to feel medial buttress, I think the interpretation was that it was the stifle somehow trying to stabilize itself against the instability. I'm not sure that's really accurate or true. I think it's probably just secondary to inflammation, because if it was trying to stabilize, you'd hope that it would stabilize circumferentially around the knee as opposed to just on one side. So I think it's really just secondary to probably some minor instability that you can't really feel yet, or as Hannah mentioned, maybe you would feel if you had the dog sedated, but you can't feel it right now with the dog awake. But yeah, it's really just secondary to inflammation and probably some minor instability, and it's just a disorganized fibrous tissue that builds up on the inside of the knee. Why the inside more than any other could be something to do with the fact that we always see medial meniscal injuries rather than lateral as well, but I don't think anyone really has the satisfactory answer to why it always happens on one side.
I think I just want to pop in a little bit of nugget of information, because I never realized until I started getting more interested that the cruciate also stops a bit of rotation, doesn't it? Yeah. So everybody always thinks of it just stopping the translation back and forth, but there's also a little bit of a resistance to an internal rotation. So it's coping with lots of forces.
Yeah, sure. Yeah.
Can we throw in the idea that as soon as we start having inflammation in the joint, we have started the process of...
Yes, absolutely. And I mean, these dogs have arthritis before we ever see them. So you sometimes hear about people talking about performing surgery for these cases to prevent arthritis. That's completely incorrect. You're too late. By the time they've developed a cruciate, they have arthritis for sure. Whether you can see it on an x-ray or not, it's there. There is inflammation of the synovial fluid, therefore there is arthritis associated. So yes, all of our treatment methods that we try and use are to try and slow down the rate of progression of arthritis. And yes, dogs seem to cope very well with stifle arthritis as long as we get that knee to be stable, but it is still there and it will always be there and it will progress with time.
Yes. So if you did want to use things like supplements, I have my feelings about supplements. I am very biased at times and I have to put my bias away. If you are going to use them, get them in early, isn't it? So if you have the first signs of a problem, that's when you would be placed to start using supplements. Or am I antagonizing you? Is that fair to say?
I have to say, like, I'm a little bit if I'm putting my kind of hat on, if I'm a client, right? So I'm already thinking my dog potentially has a condition that I'm going to need to spend quite some significant amount of money on at some point in the future, whether that's rehab, whether that's surgery, whether that's whatever you go down, whether it's both. And I'm a big believer in really, maybe it's because I'm in an academic institution, that I really only want to recommend treatments that have evidence behind them. So in terms of nutraceuticals, the only kind of nutraceutical that I'm aware of that has evidence behind it for actually improving animals with osteoarthritis definitively is the omega-3 fatty acid supplemented joint diets. So I would definitely, if I had a dog if it was my dog and I'm the client, that's where I would spend my money. And then I would be saving my money for other things that for this condition have evidence that they work. I personally wouldn't be spending my money on something that we don't have evidence behind. But having said that, they're not going to do any harm. They probably do have a minor beneficial effect. It's just not big enough that we're able to prove it in studies. So I'm not saying that it's wrong to give them. I'm not saying that it's wrong to spend money on them. It's just, if I was choosing where to spend my money, I'm not sure that's where I would spend it.
And I do like that, in that seeing people on the front line, I find that people get very caught up in having lots and lots of products that they're throwing because it shows love and affection and dedication and commitment and completeness. And quite often I feel, oh God, I'd actually rather that you got the weight off or I'd rather that you put some rugs down because that to me makes a lot more sense. I know there's a lot of people that have a big emotional connection to what they feed, but I do have to take my hats off to the diets that have weight control as well as the supplementation at the right ratio that make it very logical and sensible for owners. For me, I'm a really busy person, like stupidly busy, and that, you know, I need somebody to have done it for me, and it's like my mum in a bag. Brilliant. I've got my mum in a bag and I look after my dog. Great, thank you. So please don't be scared of these. It doesn't make you a bad person. There's this real thing online at the moment that if you choose to feed a complete or a kibble or anything, you're a bad person. So not true. So not true. It's a very emotional area, feeding. Please don't feel guilty if you take that. If you take that course. I would.
Yeah, I would as well. And I think if you look at some of, obviously, as this kind of, it's almost like a generational change that we're seeing a lot of people like who spend so much time and so much effort making homemade diets for their dogs and all these kind of things, but it's so hard to get it 100% right. And we are seeing as vets kind of almost like a resurgence of some of those diseases that we thought we'd got rid of. Things like rickets are coming back because diets are being fed that don't contain all of the correct vitamins and minerals in the right proportions. And that's not because people don't care. They care a huge amount. It's just, it's so difficult to get it right. I agree with you. With a busy lifestyle, like a complete diet is the way I would go every time.
Yeah, some people think I'm a bad person. I'm not a bad person. Okay, so we've got a few questions about treatment. So shall we jump straight now into treatments?
Yeah, I think there was one question that I saw just pop up that was about, someone mentioned, I can't even find it now, like it's with so many have come in since, about chihuahuas.
Yeah, you know, I found it. Hydrotherapist, I have been surprised by the amount of chihuahuas I have treated with cranial cruciate.
Yeah, it's interesting, and I just wanted to touch on that because I think this is one of those things where this might be something to do with concomitance of conditions, like dogs having two conditions at once, because we do know that dogs that have medial patellar luxation, for example, have up to a 25% chance of rupturing their cruciate secondary to having the medial patellar luxation. So with chihuahuas being one of the top breeds for patellar luxation, I'd be wondering whether this is a kind of a low-grade patellar luxation that's precipitated the cruciate rupture. We do see them in the little small breed dogs as well, and we often see them with both conditions at once, and have to treat both conditions at once. So I'd be wondering if that's what it is. And those smaller dogs often come in later in life with those two conditions at once because they've had the patella for ages, they've been coping with, and then suddenly they develop the cruciate on top and they can't cope anymore. So that's just an interesting thing to look for, I guess.
And that gives us an opportunity to introduce the biological nature of this disease as well as the mechanical. And I think a lot of people focus heavily on mechanical only and don't consider that medial patellar luxation has started creating an inflammatory environment within that knee.
Yeah.
I did read somewhere that they do believe that inflammatory soup that's created might have an impact on the degradation of that ligament. So is that fair to say?
Yeah, that's true, and it's again, it's one of those things that's just so difficult to prove. There have been some very well-known researchers. Peter Muir is one of them, who's been looking at the inflammatory nature of the joint fluid, and does that seem to go along with cruciate ligament disease? And it's just so hard to pick these dogs up before they have any signs of disease. So it's a bit of a chicken and egg situation, like which came first. But there's a lot of chat about potentially, are these dogs inflammatory, and does that kind of make them a higher risk for this condition? But again, I'm not sure we have the answer like in black and white yet, but they definitely both factors play a role.
Okay, Linda Scott, I hope that answers your question as well. Inflammatory supplement to help support the other ligament, please. I don't believe that there is anything in the literature to suggest that you can use a food to prevent the other ligament going. So I hope that answers your question. Hemi, about TPLO, we're going to come to you because we're going to talk about treatments. But that hip dysplasia, I find this quite interesting. When you talk about hip dysplasia and total hip replacement, quite often you have said to us, you can actually get away in many cases of just doing one. You cannot relate that to cruciate.
Not really. Yeah, not really in terms of getting the same outcome. I think it's obviously there's a difference between a joint that's intrinsically unstable and a joint that's just I shouldn't use the term just at all, but a joint that's,
I don't like that word.
So pain doesn't equal instability and vice versa. So I think the problem with the stifle is that in the dog knee, the knee is unstable. So every time they try and put weight on that leg, all of the muscle groups are not able to do what they're supposed to do because the knees are unstable. So it's different to a kind of an arthritic hip in terms of that hip is actually generally, by the time these dogs are older, that hip is stable, but it is painful. So being able to shift weight off works for those cases, but doesn't appear to work for the cruciate disease cases. Now, having said that, if you've got a dog with bilateral disease and you can only afford to treat one, your dog's going to do a lot better with one stable knee than without. It doesn't tend to let the lameness on the other side resolve.
No. Okay, that's fair. Do we head to surgery first, or should we deal with conservative first? You pick.
I think conservative first. I think it's you know, whether we want to or not, like most of us end up trying that first. So I think it's so I think it's when you talk about conservative management of cruciate disease, the problem is that a lot of the information we have on this is in the rather historical literature because it's become such a largely surgically treated condition. Most of the research recently has concentrated on those myriad of different surgical options that we have. But if we look back to the literature from the 70s and 80s, which is really when most of the work on conservative management was done, the kind of things that were out there were that if a dog weighed less than 15 kilograms, they were more likely to do better with conservative management. And that actually with conservative management, in terms of owner perception, a lot of these dogs seem to functionally do okay for a period of time. Now, we didn't have long-term follow-up on them. I don't know how long they did well for, but they seemed to recover from the pronounced, very acute lameness that they presented with to being functional and able to get around and be a very functional pet dog.
And how long does that take? Just because I know that reading your articles, you quote that a lot of them come back to weight bearing within about 3 weeks. They will start to place weight.
Right. Yeah, and I think that's very true. I mean, this very, as we said, when they come in initially, if we see them acutely, they come in like often non-weight bearing or toe touching. But even without any treatment at all, if you just rest the dog a little bit and see how they go, often within kind of a few days to a couple of weeks, they start to put a little bit more weight on the leg, and the lameness not resolves, but goes to being more like a moderate weight bearing lameness rather than that severe toe touching or non-weight bearing. So without any treatment at all, they will often get back to being that kind of lameness. Now, conservative management is going to entail very, very strict rest. And obviously, this can cause a problem for some owners behaviorally. Some dogs will not tolerate that the strict rest that is required to give your dog the best chance of recovering with conservative treatment. So it is going to be in a crate. It's going to be in a crate pretty much all hours of the day, other than a few 5-minute leash walks to eliminate and then really get back in. So that's normally combined with non-steroidal anti-inflammatory drugs or, for the first couple of weeks, some additional analgesics if the dog's really uncomfortable. But what we do know from the literature that is out there, and I say it is older literature, so it's not the most recent groundbreaking stuff, but from the literature we have, it does look like if the dog hasn't improved significantly within 6 weeks, it's not going to. So it's normally that 6-week period. And so because that is quite a short period, I have zero problem if owners want to try that, because if I do surgery 6 weeks later or even 3 months later, the outcome is going to be the same for that dog as if I do surgery straight away. So if owners want to be convinced that nothing else was going to work, then by all means, go ahead and try conservative management for 6 weeks, as long as it's not a dog that's getting completely distressed by being in a crate. There's no downside.
That's really interesting that you say that, and I really love the fact that you don't hold back, because a lot of people on a diagnosis of cruciate disease will feel that they need to attend to it very promptly, and almost I've had some people say they feel that they are a little bit ramroded into getting on with surgery.
Right.
But is there any studies out there that we can refer to about the success of surgery from the time of the incident? So is there anything to show that a dog that was treated 3 months or 6 months into a full rupture has a lot less functional results? Do you know of anything?
No, I mean, I don't think anyone's really done studies looking specifically at that, but in all of the studies, or at least the vast majority of them, the authors have kind of written down how long the lameness had been going on prior to surgery being performed. And to my knowledge, there's not a single one of them that's, when they've done the kind of their statistical analysis, there's not a single one of them that's ever come out there and said, well, actually, the longer the dog was lame, the worse the prognosis was post-surgery. Yeah. I've done TPLOs on these patients when they've had a cruciate ligament for 2 years, and they've still gone on and done great post-operatively. Yeah. So, I mean, yes, the stifle might not look as pretty on the radiograph as you would like. It's going to have more evidence of arthritis, most likely. But clinically, they still go on and do great. So this is definitely not something that I ever push people into. And in fact, if you think about post-operatively, the care that the owner needs to be able to give post-operatively to make sure that the surgery is a success can be quite intense in terms of the rest that they have to be involved with and supporting the dog maybe for the first couple of days and all that kind of thing. So I always say to owners, it's far more important to me that you're ready to commit to the post-operative care than that we rush your dog into surgery straight away and then you're not set up at home. You've still got slippery floors everywhere. You don't have a crate. Your dog's gonna be jumping on the sofa every day.
Yes.
Those kind of things.
Okay, that's good. So hopefully that helps a lot of people that might be in the situation now where they're feeling almost like they're getting panic attacks and they've just got to do something about it. Chill out. Breaking news. Chill out. You can take your time. Dr. Karen Perry says so. Yeah. Something that interests me, and I want to explain to CAM followers, there is a lack of data. You can understand having owned dogs and choosing to treat some of them and not treat other ones is very ethically challenging. You know, by the way, Mrs. Smith, we've decided we're not going to treat your dog and it might come out worse. But are you okay with that for the, you know, science and the benefit of everybody else? It's very hard to collect real life data with real life pets. So data is often limited in these situations, but something to just go back to, the conservative work from the studies that you referred to in the 70s, 80s, 90s, whatever it was, there is a really big developing field of rehab. And I don't know if there's a huge amount of data about dogs that might have had early onset rehab, which are just, light therapeutic exercises, stabilizing, proprioceptive, building exercises. There is a paucity of data there, isn't there?
There's a huge paucity of data there. And I think it's partly because obviously as soon as we have a dog that it has demonstrable instability of the knee, the tendency is that we all say, well, eventually this is likely to become a surgical case. So, but the early cases, as you mentioned earlier, are so difficult to diagnose. So have I sent cases that has come into me with a mild limp maybe, and I haven't been able to demonstrate instability. And then I say, well, I'm not really sure what's going on at this point. Let's try some rehab and see what happens. And maybe that dog does recover, but we don't have that data out there to know, so.
And that's the honest truth, guys. And I'm just going to quote Laurie Edge Hughes. She did a lovely training podcasty thing about conservative management. And then she said, shame on us for not having a conservative management plan for people, because a lot of people can't afford it, or the dog's, not suitable for surgery or an anesthetic risk. And I wish that we could give you the thumbs up. Hey, go rehab, go rehab. Unfortunately, it's just not there yet. But it doesn't mean that you shouldn't try it. And I think there is definitely scope of working with a qualified physiotherapist in a very constructive plan, looking at, slowly introducing exercises, keeping pain control, high, and slowly trying to encourage, stamina, stability, proprioceptive understanding, and see what can be achieved within the 6-week period. But as Karen says, a lot of the time the dog's got to be completely restricted. Mm-hmm. So engaged exercise with focus of what you're trying to achieve, and the rest of the time rest, because we do inappropriate torsional impactive movements that a lot of dogs will do, because they'll go, the postman's here, oh my god, the squirrels, they're here. So that's why we talk about cage rest, is because their brains do different things. They don't go, no, mum said I've got to rest, I'm just going to keep it low. So conservative, great breaking news. If you would like to do it and try it, then, by all means, but get support, get your foundation, get your environment controlled, get your restricted exercise. Make sure you're capable of restricted exercise. Think about it. Okay, so let's move.
Need some pharmaceutical support to do the rest, because if this is a 4-year-old Labrador keeping it in a crate, you might need us to help you out with some trazodone or some high-dose gabapentin or something that's going to help that dog actually rest, because if it's bouncing around in the cage for 12 hours a day, that's also not going to be very effective.
No. And do you know what? That's actually a really good point. A lot of people feel very, very emotionally challenged about using medication for anything behavioral, whether they feel that they're going to blend their brain and the brain will never come back, or whether they feel guilty that, you know, I think there's a strong belief that you're changing your dog's personality. You're not. If you're about to try and prevent doing a $2,500 surgery by taking a conservative approach, and you're going to spend 6 weeks doing it, don't feel bad about using all the tools to make it happen. Okay, sure. Good point.
Yeah,
I like it.
Just one point to bring up, I guess, a little bit about the conservative management, because I think there's two things that all owners should be aware of if they're going to do conservative management for their dog. So in addition to what we've already spoken about. So one is, as we alluded to earlier, the very high percentage of bilateral cases. And if we are managing a dog conservatively, what we have seen happen occasionally, it's not common in any way, shape or form, but what can happen is if they do rupture the other side at the same time and both knees are very unstable simultaneously, then these dogs can look profoundly abnormal. And we've had them referred to neurology because it looks like they can't get up and walk around. They don't shift their weight appropriately because they can't. And we've even had some of these dogs go into kind of intensive neurological workups and things because people presume they're neurological. So a bilateral cruciate dog can look like a spine dog. So just be aware of that. If your dog goes off its legs, it hasn't suddenly developed a new condition, most likely. It probably just has the same condition on both sides.
That's very, very good point. And I know that has happened around the world many, many times.
Yeah.
So let's just see whether we can hit into surgery. How are we doing for time? Oh my God, it's already 1:45.
What?
Okay, right, so let's do surgery. You might actually have to come back. We might have to divide it into two.
Fair enough.
Would you have time? Would you ever have time to come back and do surgery at a separate point? Yeah. Okay, this is cool. Let's stay with more conservative management plans and talk about somebody asked a question about rehab afterwards. And we'll talk about the surgical choice at a later, because otherwise we're just going to fly through it and it's not going to be as useful. So let's go to that question. What are your thoughts on rehab for knee surgeries for the benefit of controlled low impact exercise, etc., post-surgery during the healing?
Yeah, absolutely. I think I'm a huge fan of rehab, and say exactly as Hannah mentioned earlier, we're lacking a lot in terms of the research to support use of rehab. So I can't really give you a whole load of studies to say why I like it, but my experience is and the studies that are out there tend to support that we do get improvements with using rehab pre and post most conditions, to be honest. So I use rehab a lot for these dogs with cruciate disease, and I'm going to go first to even pre-operatively, because I mentioned earlier that we sometimes see these big mastiffs and Rottweilers and things coming in with bilateral disease when they're still super young. And at that stage, if they haven't stopped growing, they're poor surgical candidates. We don't want to do surgery until they've finished growing, unless they're super, super young, in which case we have some cool and funky options, which we can talk about next time. But in terms of if they're about that kind of 8-9 months, they've often been neutered young, all their growth plates are still open, and so we can't do surgery until those growth plates have closed. And those guys, I get into intensive rehab immediately, because otherwise what happens is they shift all their weight onto their front legs, as Hannah mentioned. They become a triangle dog because they have loads of bulky muscle at the front, no muscle at the back. And by the time we see them back and we ascertain that their growth plates are closed and we can now do surgery, they have no muscle, and then they have a really hard time recovering from surgery, and it takes them a long time to get back to being normal and being able to go into any training the owner might want to get them into, those kind of things. So for me, if we see them early, then they're in rehab, and we're encouraging weight bearing, we're getting them in the water treadmill with support, we're doing all those kind of things to make them use their legs as normally as they can while they're developing. So
and pain relief is key, I should imagine.
Yes, absolutely. Well, for any rehab, really, I don't find if I send a dog to rehab without sending it with appropriate pharmaceutical support, so non-steroidals, multimodal as necessary, they don't rehab well, because rehab in itself is painful. If we've gone through rehab ourselves, we know you can go in with something that's not even that painful to begin with, and then rehab makes it painful because they've encouraged you to weight bear on it. So I always send my dogs to, if I'm sending them to rehab, I send them with a good multimodal plan. And luckily my rehab person is in the same building, so we can liaise. If my plan is not adequate, we can bump it up or take it down or change medications. But I think that's absolutely, it's key. If they're going to get the most out of rehab, they need to be, to have their pain controlled. Yeah.
And that's really important. Again, I see all the time with owners is they think it's one or the other. And arthritis, every element of it is about embracing different elements of control to make you have an optimal endpoint. Somebody said thank you.
Post-op was the other question. Rehab post-op was the other thing someone wanted to hear. Yeah, and I think it's one of those things, again, like if in a gold standard world where you have an owner who has no time restrictions and no financial restrictions and can do absolutely everything you recommend, then yes, I'm going to tell them absolutely get your dog into rehab. Let's do all these things. Laser therapy, potentially, water treadmill therapy, sit to stand exercises, all those kind of things, all going to be very helpful. However, one thing I do say to owners is a lot of these owners, if they've had surgery with us, because we're a specialist facility, they've spent $4,000 on this surgery. For some people, then rehab on top of that is just too much. It's just not taken conscience. So one thing I would say with some of the surgeries we'll talk about, the osteotomy surgeries, particularly where the bones are cut, these dogs tend to weight bear very quickly after surgery. Within 48 hours, they're putting weight on the leg. And you can give these owners a kind of at-home rehab plan to encourage them rather than needing to necessarily be at rehab twice a week. So gold standard, yes, get them into rehab. But if you don't get them into rehab, if owners can't conscience that for whatever reason, you can still get an amazing result following surgery with things that you can just easily instigate at home.
Don't you just love her? She's so practical and logical and, real life. This is important for you guys. It's real life. I don't have a money tree. I wish I did. So this really does count. Somebody has put a very, very good question. Can delaying the op not result in meniscus tearing?
So yeah, and that's a very good point. So in terms of if we have a very unstable knee and we don't stabilize it immediately, does that mean that dog's at a higher risk of developing a meniscal injury? Theoretically, yes. I don't think it's been proven per se, but yes, it makes absolute sense that would be true. And I guess the thing to then think about with that is, does that mean I should be pushing these owners into doing surgery a little sooner? And again, theoretically, yes, the meniscus is great. We want to keep the meniscus intact if we can. However, if we look at clinical results after these surgeries, if you compare the dogs that have had a meniscus removed because it was damaged or a meniscus that's left in place from the outside, vets and owners alike can't tell the difference. Right. So in terms of, is it a reason to rush them into surgery? For me, and not unless the owner is absolutely comfortable that they were going to go to surgery anyway, because I think even if the meniscus does go, I can still get a good result for that dog after surgery. So theoretically, yes, completely right. Very good point. But it doesn't necessarily mean for me that I rush them in or push them into surgery sooner.
And I think that's another really fair point, is that there isn't a black and white with this. There is a human element that has to be considered with any of these interventions. And I know how I felt, a totally different thing when Holly had to have liver cancer. Geez, I felt rushed. Obviously, it was rushed, but it put me really on the back foot of decision making. I felt paralyzed with my decision making. And I think the owner needs to be considered in the process as well. So also, it's fair to say, and we'll cover it in the next one, is sometimes meniscus is a problem even after surgery, but we'll cover that in the next one. Yeah,
absolutely.
Somebody asked about about small recovery areas for dogs who hate crates. It's about the logic. Okay, what you're trying to do is stop a behavior, stop a movement pattern that is going to be deleterious for the area. So if your dog is a calm dog that in a penned area would rest, not bounce around on the back legs, suddenly become a circus dancer, then fine. But if your dog is going to be permanently trying to jump the gate, then no. So it's used logic in your plan of restricted exercise. How common is the meniscus tear after TTA? What we'll do is we'll do that next one. So all of you guys that now want to know about surgery, we're going to cover it next time. We're partly rushing because Karen is so busy. She's now got a 3-hour meeting. She's already done 5 hours today, and you've got another 3-hour meeting. So she does need to leave on the dot. So I think let's end with braces and talk about all the surgeries at the next visit, which I'll get a date as soon as we tie up.
Absolutely.
Brace.
Yeah. Braces is probably, I would say, the most controversial topic that we deal with right now. There's a lot of talk about braces for cruciate ligament disease and rupture, and can they do anything, and is there any evidence? Short answer, is there evidence for any of these things? No. We have no evidence to say definitive peer-reviewed evidence that says that a brace is helpful. Now, that doesn't necessarily mean all braces are unhelpful. It depends exactly what we're talking about. Now, if we're talking about some kind of compression bandage that's also giving cryotherapy, so ice therapy to the knee, sure, that's going to help reduce inflammation, and that's probably a good thing. If you have a dog that's, as Hannah was alluding to, super, super crazy and won't rest otherwise, sometimes some form of brace or external coaptation will help reduce the amount of instability going on in that knee and make them more comfortable while we're managing them conservatively. So all of those things theoretically could be true. In terms of, do I think there's a brace out there that is going to remove the need for surgical management in a dog that would otherwise need it? No. That's my personal thing, and based on the evidence we have, there's nothing that's been proven to do that. The braces that are going to be helpful or have any chance of removing the need for surgery, I guess if we're going to look at them in the future, are going to be the ones that cost almost as much as surgery themselves.
Yes, that's what I was saying.
So it's going to be the ones like, I mean, there are some fantastic companies out there that make some fantastic products. Orthopets is one of my favorite. They make some customized braces that are absolutely great, but they are so pretty pricey. Yeah, but they are pricey.
They're so clever because they've got different areas of movement. It's not just a hinge. It's not it's not like a it's not like a wallpaper paste table where you just pull the legs out and it moves like that.
No,
it's
they're
so
fabulous.
complex.
And you can dial in how much motion can occur at each joint. You can change it during the recovery process and all that kind of thing. I mean, they're great. And I have to say, following Achilles tendon surgery, I use them on all of my dogs, or I advise all of my owners to get those following that surgery. But for cruciate disease, you're kind of paying as much as you would for some surgeries. And at the moment, we don't have the evidence to say that it's going to remove the need for surgery. So I guess if you have a patient that's a really poor anesthetic risk, it's never going to be allowed to have surgery for other reasons, then it would be something that's maybe worth trying. But I think you have to be aware you're doing it without any evidence that it's going to resolve that instability. And likely you're going to end up using it whenever the dog exercises long term, as opposed to use it for 6 weeks and it's going to have cured the problem. The long-term solution for dogs that are not good surgical candidates, then absolutely I'm not dismissing it. And the evidence really we don't have. But one thing that makes me very dubious about whether this evidence is ever really coming is we've done surgeries such as putting great big metal scaffoldings across the stifle for other conditions to add extra support. And that's with pins going into the bones and the pins being connected by a triangular frame on the outside. And even that doesn't prevent the muscles contracting, doesn't prevent the force going through the tendons and all that kind of things themselves. Yes. So I'm dubious then that something that just goes on the outside of the leg on such a well-muscled area, such as the stifle and the thigh, that we're going to really resolve instability there. And another rule that we always apply with any kind of external stabilization is if you're going to stabilize that joint, you also need to stabilize the joint above it. And stabilizing the hip in these dogs with anything external is going to be next to impossible. So I'm dubious that it's ever going to be an alternative to surgery, but I'm open to the possibility that in the future it may be a good alternative for those dogs that are not good surgical candidates, I guess.
Yeah, I think, and I went to a lecture by Sherman Knapp, and he was talking about braces, and you know, he really wants, it sounds like a pun, he wants to embrace braces, but he too was saying, I'm still really not convinced. For me, who knows nothing about this area, so doesn't have a bias whatsoever, I'm just worried that they're freely available.
Yeah,
that scares the crap out of me. I've seen people that have used supports for other joints and the disaster that can ensue. We had one recently, a carpal support, and was just being used ongoing, and it was a full, you know, firm carpal support, and it was caused some sores. The dog was actually weight shifting away, probably because of the support. And actually, without the support, the dog probably would have been more comfortable and would have probably put more weight through that leg. It was like, if you're going to go down that path, you need to be with someone that's got a lot of experience, in my opinion. And I would be the first to put my hand up and say, I'm not that person. You know, I would want somebody that's really got a lot of understanding.
Right. For sure. Even when you have a customized brace made by orthopeds, it's still recommended that you go back, you get it fixed. Like it may still rub in certain areas. You need to have that then adjusted to make sure it's not causing ongoing problems. Like, I'm not a big fan of any kind of bandages at all, because I've seen worse complications from them than I've seen them fixed generally.
Yeah. And also, I think I was reading that it's really undecided how much they need to be worn, you know, and they're not easy to put on. They're quite complex. So if you think that you're going to put it on every time your dog gets up to go for a, you know, 10-minute walk, stop with it pretty damn quickly.
Yeah.
So I think it's looking at the bigger picture. I hope that we eventually will be able to offer that, because I'm a massive believer that we should be able to offer solutions for all dogs of all owners. And, you know, great, come on, but I haven't heard amazing things yet.
No, not yet anyway.
Not yet. Right, we're going to stop, because I need to get the UK house dwellers outdoors and slamming their saucepans wildly for our NHS. Karen, I think you're amazing. I always think you're amazing. And we'll wait in the diary. We're going to come back and we're going to talk about surgery for you guys. But please say thank you to her, because she is a legend. And I just love talking to her. So thank you, Karen. I'm going to run outside the door and start clapping.
Absolutely. Clap for me as well.
I will do. Bye.
Bye.